You're listening to Dispatch Radio, sponsored by theglobaldispatch.com.
This world has nothing for me. This life is not my own. I know you go before me, and I am.
Well, welcome back to Dispatch Radio. A relatively rare parasitic infection has been reported in significant numbers in parts of the Midwest. Here to discuss the Cyclospora outbreak in Iowa is Dr. Patricia Quinlisk. She's the Iowa Department of Public Health Medical Director and State Epidemiologist. Hello, Patty, and welcome to the program.
Well, thanks for asking me to come on.
Fantastic. First things first, since many of our audience probably are not familiar with this parasite, can you give us a snapshot of what Cyclospora is and the symptoms that you would encounter?
Sure. It's a very, very small parasite that you ingest, and it gets into your intestines and basically causes quite long, very bad diarrhea. The diarrhea can last weeks or months. And it's often accompanied by very severe fatigue, loss of appetite, etc. It's just a pretty miserable disease.
Yeah. Now, Cyclospora, for those who are not familiar, made national headlines in the mid to late 1990s when about 1,000 people were sickened throughout North America due to contaminated Guatemalan raspberries. Last week, your health department said, although the source of this outbreak is unknown at this time, this investigation currently indicates fresh vegetables and not fruit as the possible source of the illness. What in the investigation points you to fresh vegetables? And if you could answer this, have you narrowed it down? Would it be vegetables that are served in restaurants, or is that something that citizens of Iowa are buying at the grocery store?
Well, first of all, the reason we know that it's probably a vegetable, not a fruit, is when we find people who have this disease, we go back and we do these very extensive interviews. The questionnaire is actually 15 pages long, so you can imagine how many questions we ask people.
Sure.
And basically we're finding that people did not have any fruits in common, but they did have some vegetables and vegetable products in common. So now we're focusing on those vegetables. There's about a handful of vegetables that we're looking at. We haven't narrowed it down any farther. And these are vegetables that get on the market for everybody. So they're on the market for an individual citizen, a restaurant, a group of people, whatever. So now, at this point, the people who do the food investigations are trying to figure out what may have gotten onto our market.
Sure. Like many outbreaks, so the sources often remain unknown. Do you think that's going to be the case in this outbreak?
Well, like I said, we've got it narrowed down to a handful of vegetables, so I'm optimistic that we will be able to figure out, at least at a certain level, where it came from. Whether we'll be able to go all the way back to the exact field on the exact farm, that may not happen.
Right. Are there certain people that are at higher risk for this infection, of a serious infection?
Well, everybody is susceptible. I mean, anybody can get it, but certainly some people do have a little bit of immunity to it, especially if you've had it before in your life. And we know that if you get it and you're very young or very old, or you are immunocompromised, you're going to be sicker and it's going to last longer.
Right. And is there a satisfactory treatment for Cyclospora?
Well, the good news is there is. It's sort of unusual. You'd think with a parasitic disease, you'd give the person an anti-parasitic medicine, but in fact, for some reason, which we don't understand, there's an antibacterial or an antibiotic that works against this. It's got a long name. It's called trimethyltryptophan-sulfamethoxazole, or TMP-sulfa. It's a relatively common antibiotic, but this one does seem to work, and so if you have it, you need to take that drug, and you should get better within a couple days.
Okay. Some of your neighbors out in the Midwest, looks like Nebraska, parts of North Texas are seeing dozens of cases. Have you at the Iowa Department of Health established any connection among the various state outbreaks?
Well, when we started seeing our outbreak, one of the first things we do is we put out an alert not only to the public and the health care providers here in Iowa, but we put out an alert to our neighboring health departments and, of course, to the CDC, et cetera. And we heard back very quickly from Nebraska that they were seeing something too. So really, almost from the very beginning, we've been working with Nebraska. Now, other states have noticed cases as time has gone on, but I would say that we worked with Nebraska the closest because they seem to be having the problem about the same time we were.
Is there a connection, do you believe?
Yes, I do think so. We know that a lot of the food distribution systems for Iowa and Nebraska are the same, so we do believe that ours are related. Now, whether or not Texas is related or not, they're still investigating that.
Sure. And if the case is fresh vegetables, as you suggest, is the outbreak winding down?
Well, it is. Even though we're getting cases every day still being reported to us, the people who are being reported to us are unfortunately people who've been sick for a month or so and are just now hearing about it in the media. They go into their doctor, they get tested, find out they've got it, it gets reported to us. So these are still people who started getting ill back in June. We've had almost nobody who got sick in July. So we do believe that since it is a fresh fruits and vegetable, probably a fresh vegetable, that these people were eating it in early to mid-June, and that really means that it's going to be off of our market by now because fresh vegetables just don't last this long. Okay.
And we're coming up against a break, so this will be my last question, Patty. Okay. And being a microbiologist, I have a lot of curiosity in this one. This parasite has been quite rare in the state of Iowa, with some 10 cases over the past 2 decades, so one every other year. You're up to 109, I believe, as of Friday. I have to ask you, as the state lab, or as the medical director, when the state lab started telling you earlier this month, hey, Dr. Quinlisk, we got 2 cases of Cyclospora, we got 4 cases of Cyclospora, what went through your mind?
Well, yeah, and you start thinking, well, something's going on. When we had 2 cases, we actually put out information and started alerting people, especially our healthcare professionals around the state. And we know that once we do that, they usually respond, and all of a sudden they start testing more people. So we did expect to see a lot more, but I don't know that we expected to see this many people, especially it's so unfortunate that this many people have gotten such a serious illness. So, we jumped on it pretty quick to try to find out what it was because, of course, our main concern is if there's something still out there making people sick, we need to get it off the market.
Very good. Okay, I would like to thank Dr. Patricia Quinlisk, the Iowa Department of Public Health Medical Director and State Epidemiologist, for her time and expertise. Patty, thank you very much, and have a great weekend.
Thank you. You too.
Okay,
bye-bye.
Again, it was just fascinating listening to you guys discuss this and realize that we've got about 4 different states that are having a major battle with this of some way, right?
Oh, at least 4. There's also some reports maybe out of Illinois, out of Wisconsin. I've yet to find them on the health department websites. However, newspapers are reporting that. So is there a common connection? Are we reliving 1996 again? Not sure.
All right. Well, we're going to shift gears.